In the heart of one of the wealthiest and most technologically advanced regions in the world, Europe, tens of thousands of people are still dying every year from diseases that modern medicine has already rendered preventable, manageable, or even curable. This is not the result of scientific failure. It is a moral failure, a systemic failure, and ultimately a failure of political will and public health execution. Despite decades of research and the existence of effective tools, Europe continues to lose lives to infections like HIV, viral hepatitis, and tuberculosis, deaths that should no longer be happening. These are not obscure or exotic diseases. HIV can be prevented with modern medication like PrEP, and those infected can lead long, full lives with access to proper antiretroviral treatment. Tuberculosis is a bacterial disease for which treatment has existed for decades, yet over 3,500 people still died from it in 2023 in the EU and EEA, according to the European Centre for Disease Prevention and Control, ECDC. Hepatitis C, perhaps the most jarring example, claimed around 35,000 lives in 2021 alone. This is a disease that is now curable within weeks using widely available antiviral drugs. And still, the deaths continue. What's particularly alarming is not just the absolute number of preventable deaths, but the stagnation, if not outright regression, in progress. While ambitious global health goals were once set to eliminate HIV, viral hepatitis, tuberculosis, and sexually transmitted infections as public health threats by 2030, the reality on the ground is sobering. As 2025 approaches, the interim goals are clearly off track. The ECDC admits that there have been no substantial improvements in recent years, and in some areas, the situation may even be deteriorating. The numbers should provoke outrage. Each one represents not just a statistic but a person, someone's child, parent, friend, lost to a disease that should no longer carry such a deadly cost. Approximately 15,500 people died from hepatitis B in 2021 alone. And hepatitis B, unlike hepatitis C, is preventable through vaccination. Yet coverage remains insufficient across many European countries, particularly among high-risk populations and migrant communities. In the case of hepatitis C, where a vaccine does not exist, screening and access to treatment are the key tools that are tragically underused. The underlying causes are not scientific or technical. They are political, structural, and in some cases cultural. Stigma around HIV continues to prevent people from seeking testing and treatment. Migrants and marginalized communities often fall through the cracks of health systems that are fragmented or underfunded. Preventive measures like harm reduction for drug users, sexual health education, and accessible vaccination campaigns are undersupported or outright ignored in many areas. The result is not just persistent infection but chronic underreporting, delayed diagnosis, and missed opportunities for intervention. What's worse is that this is occurring in a region with ample resources. Europe has the infrastructure, the knowledge, and the pharmaceutical capabilities to eliminate these diseases as serious threats. And yet, we are still seeing AIDS deaths. We are still seeing liver failure and cancer from untreated hepatitis. We are still seeing families shattered by preventable loss. That is more than a public health failure. It is an indictment of complacency. The warning signs are everywhere. As antibiotic resistance grows and trust in public health weakens in the wake of the COVID-19 pandemic, the risk of letting curable diseases evolve back into mass killers is real. Europe, with all its advantages, should be leading the global fight against infectious disease. Instead, it is allowing silent epidemics to fester within its own borders. Dr. Pamela Rendi-Wagner, director of ECDC, has called for immediate and decisive action over the next 5 years. But words will not suffice. What's needed is concrete investment, political commitment, and a willingness to confront uncomfortable truths about inequality and neglect in healthcare systems. Routine screening for hepatitis must become universal. HIV prevention must be aggressively scaled. Tuberculosis treatment must be ensured not only for those in stable housing but also for the displaced, the undocumented, and the invisible. Time is short. The diseases in question move quickly, but bureaucracies often move slowly. If Europe fails to act now, it will continue to let thousands die unnecessarily. And that will be a tragedy not just of health, but of justice.